Hello, everyone, and welcome to today's webinar, Let's Talk Trash, Waste Management in Healthcare. This is Elizabeth, and I'll be moderating the event today. I'd like to go over a few items before we jump into our presentation. To minimize background noise, we have muted all attendees. However, we encourage questions and comments throughout the presentation using the chat box located on the right-hand side of your screen. This applies to any technical assistance you may need, as well as submitting questions about the information covered. I'd like to introduce our speakers. Today we have Jill Paul, Principal Consultant specializing in hospitals and healthcare with over 25 years of experience in EHS, healthcare compliance, and emergency management. She's joined by Allison Juris, Senior Consultant specializing in EHS support for healthcare and a Certified Hazardous Materials Outreach Instructor. I will now turn this presentation over to Jill and Allison.
Hello, everyone, and thank you so much for joining us on our journey through trash. We appreciate the time you're spending with us today and hope that you find this entertaining as well as informative. Next slide. Our agenda for today is going to be your hospital waste, what we've been seeing in the news, how to drive compliance within your facility, not just by quoting regulations, but by actually diving into what your staff feel is valuable and compelling, and then end with some best management practices. So the question is, do you know your hospital waste? When we originally put this together, we created a game, and the game allows a user to see a object of hospital waste. It might be a sharp, it might be a kidney, it might be some sort of pharmaceutical. And then the game allows them to pick the right container to drop that particular waste item in. And then it scores them, whether they were right or wrong. That was a little too cumbersome to do in this format, so we've done it as a poll. So we're going to ask you a couple of questions and you will have the ability to answer them.
Okay, let's start with our first poll question. Elizabeth, I actually can't see the poll. Would you mind reading the question, please?
Which container should you use to dispose a bottle of Taxol? I think it's the next slide as an image to go along with it.
So let's give everyone maybe 5 more seconds to select an answer, and then we'll go to the next slide, which has the answer.
Can I ask, can you see on the webinar the containers? Because we can't see them.
Oh. So interesting, but I can talk you through what I see. There's a picture of a bottle of Taxol, and there's a chemotherapy waste container, a RCRA hazardous waste container, a biohazard container, a controlled substances container, a municipal landfill container, and then a red sharps container. I'm not sure why we're not seeing that. Let's go ahead and close the poll, Elizabeth. All right, so maybe now you see the slide with the waste containers. All right, great. And let's go to the next slide, which should have a picture of the right container that this waste would go in, which is your chemotherapy waste container. All right, let me go to the next slide before we open the poll so you can see the diagram. And then let's open the poll in maybe 3, 2, 1. Go ahead and open the poll. And now I know you can't see that, but that was a piece of gauze saturated with red blood. So let's close the poll in maybe 5 seconds. And 3, 2, 1. Let's go ahead and close the poll. And then we can move on to the right answer here, which is your red biohazardous waste step can. So again, this game was designed to be used as kind of a educational tool for some frontline staff that could, at the point of generation, a fun learning opportunity and teaching tool for your staff at the front lines generating your waste.
Yes, as Allison mentioned, we know that a lot of staff don't learn death by PowerPoint. So we try to come up with some really engaging ways that are fun for them to where they get a big yay, you got it right, or a, ooh, maybe not quite so right. So this is just a very small sample of a game we have available.
Yeah.
And in this picture, we're showing some actual photographs of a beach that might not be so far away from you. We know when we're trying to drive compliance with staff around waste management that we have to go beyond the regulation. We know that our clinical staff are driven by doing the right thing for the patients, staff, community. And we want to make them aware that when waste is not handled appropriately, it simply doesn't disappear when you put it in the container. It can end up in locations such as this.
And what you see here are some news stories that you may have come across over the past few years of when we have hospitals or medical centers that have ended up in the mainstream news media and for different reasons. Our first one here is 12 University of Pittsburgh Medical Center hospitals were fined by the state's Department of Environmental Protection for improper waste disposal. That sum total was $451,000. We have one teaching hospital in Wisconsin that came in at $360,000, and Scripps Health and Sharp Memorial Hospitals in San Diego settled lawsuits for $375,000, and that was for the improper handling, storage, and transportation of medical waste. And I would bet most of you, if not all of you, are familiar with the settlement in late 2023 from Kaiser Permanente, where they settled with the Attorney General of the state of California for $49 million for improper waste disposal practices. And then in 2021, the EPA actually cited George Washington University Hospital in DC for $108,000. So this can be a very costly expenditure for your institution. Those right there, and that's by no means all of them, but just these select six, I believe, five, uh, had a combined total of a little over 50 million. Later in the presentation, you'll see an example that we have for the financial enforcement penalties that could be enacted. But these are real life, what we're seeing in the media for how institutions are being directly affected by improper disposal practices.
And if I may,
Mhm.
what you saw starting here was with the big box stores. If you remember that the Targets, the Walmarts were all getting hit for improper disposal of waste. So now it appears that the bullseye has moved on to healthcare organizations. And though we showed you just a few examples, we are currently aware of many more that are occurring with very high fines.
So here's an example of the statutory daily maximums. Now, this is just for the state of California, but other states do have similar matrices for determining how they will structure financial enforcements against institutions. Each of the categories here for the extent of deviation and the potential harm have their own decision tree for whoever's determining the financial enforcements to determine where the issue will fall in this matrix. These are initial penalty amounts for each violation for the day that the violation continues. So if you're on the receiving end of this and they determine that you have a moderate extent of deviation that has a moderate potential harm, one finding in that category could run you anywhere between 16,800 and 42,000 for just that occurring on one day, one finding on one day. And if that were to continue for more days beyond that, every day that issue is not resolved, you could, it's 16,800 one day and 16,800 the next day and 16,800 the following day. And this adds up very quickly. All right, what you see here are a list of what's available in publicly available information for what medical centers have been cited for. And it's kind of nothing here is rocket science. This is, kind of hazardous waste management 101 of preparing hazardous waste manifests, failing to maintain records. We would love to think that we're all perfect and do everything perfectly every time, but things do slip through the cracks, and little things like not maintaining paperwork or not making sure that every staff member who is generating or handling hazardous waste has the appropriate level of training. These, as you saw on the previous slide, can add up very quickly. So our goal is to try to keep this from happening in the first place, or if an issue is identified, to rectify it as soon as possible.
So now we want to talk about how do you drive compliance in your healthcare facility? And as I mentioned earlier, we don't find that you get a lot of success by going and saying, you have to do this because that's what the regulation says, or that's what the law says. We find that you drive compliance by focusing on what makes people literally want to do the right thing. So here's a question for you, and I'm looking for some answers in the chat. What waste is in your healthcare facility? So if some of you could just drop a message in the chat, what kind of waste do you find in your healthcare facility? And I'm very patient about waiting. Anybody?
We can
How
move
about
on
if
to
I
the
give,
next.
yeah, we'll show some to you. So do you have biohazardous waste in your medical facility? Biohazardous waste is actually a very broad category of waste and can include infectious materials or potentially infectious substances. Typically what a lot of us will just call red bag waste. Do you have red bag waste? Blood products. So I would say in most, if not all hospital healthcare settings, you will have this type of waste in your hospital. I saw one thumb up. Can I have more thumbs up for people who have this in their hospitals? Woo,
There we
there we
go.
go. Love positive feedback because you guys get tired of just hearing us talk. So I love the feedback. Thank you so much. On the next slide, sharps waste. And a sharp, the definition of a sharp is extremely fluid. It's basically anything with a sharp point or a sharp edge that can puncture, cut, lacerate, break the skin. Some of the things we have here are more common examples: needles, wires, clamps, broken glass. It can be broken plastic. It can be razor blades. It can be any sharp type of object that will break the skin. And then once you have these, where do they go? Are they only contaminated with a blood product? Could they have something else on it? This is a decision point that might be made. Again, thank you for your responses. Chemotherapy. So how many people have chemotherapy in their hospitals? Lots of thumbs, lots of thumbs, lots of thumbs. You might have an oncology unit. You might actually have a cancer treatment center that is completely separate from your hospital. But when we're dealing with chemotherapy waste, we tend to break it down into two separate categories. One being trace chemotherapy, when that contains only residual amounts of the product, typically only something that you might have in PPE. And then we have bulk chemotherapy, which is when you actually have some of the agent that needs to be disposed of. You might see that in an IV bag. You might see that in a vial. You might see that in a bottle. And one of the things that we have found interesting is, how does your state define empty? It's different from state to state. If you are in the state of California, empty means there's absolutely no residual material in the container. So if you have 2 drops of something in the container and you say, I'm going to recycle this or I'm going to put this somewhere else, you can't do that because it's still considered waste. Next slide, please. Pharmaceutical waste. The Resource Conservation and Recovery Act, and we'll talk about the origin of that act in a little while, outlines the proper disposal and management of hazardous and non-hazardous waste. There is pharmaceutical waste that is considered non-hazardous, and there is pharmaceutical waste that is hazardous by the RCRA definitions. And this goes all across the United States. Some states have some regulations that are considerably more stringent, which requires you to dispose of more of your pharmaceutical waste as hazardous waste. But across the board, RCRA applies regardless of the state you find yourself in. Going forward with RCRA, there are different listed types of waste: F, K, P, and U listed wastes. Now, K listed wastes have to do with veterinary pharmaceuticals. So if you don't have any type of lab or any type of facility that uses those drugs, you may not need to necessarily spend a lot of time considering this. But the other categories do have common hospital products in them. F-listed wastes contain acetone, toluene, methanol, xylene, and you might not think, well, in my clinical areas, I don't have a lot of that, but in your engineering shops, they use these types of chemicals. P-listed drugs are acutely toxic. They can include arsenic, arsenic trioxide, epinephrine, cyanide salts. And then you also have U-listed drugs, which can be unused pharmaceutical chemicals and pesticides, including warfarin and phenol. So think to yourself as you're looking through this list, if you have someone at the bedside who is administering warfarin, do they know that that is actually a RCRA hazardous waste? So if you typically have, for example, a blue container where you put your pharmaceutical wastes, would they know that that is not the container that that would go in? That that would need to go into the container you have designated for your hazardous waste, which typically would be a black container. Do any of you have these at your facilities? Who has warfarin in their medical center? Yep, warfarin's common. What about epinephrine? So the thing we want to make sure and point out is that some very common drugs used in healthcare are actually hazardous waste, not non-hazardous pharmaceutical waste. And we realize that the person at the point of generation of these wastes are the people who are typically making the decisions, and we need to really help them and support them in how to make that right decision.
Especially, I will say one other thought here, especially if you're using travelers and they're coming, they're working in a number of different states. They have worked in a number of different states and a number of different institutions. It can be particularly challenging for people to keep track of in this facility right now, this waste is disposed of in this manner. So if they haven't received specific training to your organization's waste disposal practices, you may think, oh, everyone handles this waste in a certain way. Of course, arsenic trioxide is managed this way. Of course, an aerosol container is managed this way in this type of waste. But truth be told, they may have learned that in another institution in another way, and they may not realize if it's not specifically covered in training, they may not realize that they're putting that waste in the incorrect container for your facility.
And I would say 2 of the wastes we most typically see that aren't being handled correctly are silver nitrate, the silver nitrate sticks, and also aerosol containers, because those have to be segregated separately from your regular hazardous waste container.
Waste is exceptionally nuanced. I think we're all in this call. We all know that it is a very tricky situation with lots of potential points of failure.
So here's a list. It's a little bit of an eye chart, and I apologize for that, of some healthcare hazardous waste examples. Some P listed wastes, some U listed wastes, and just take a look at what are on these charts. And sometimes you actually will have a pharmaceutical that has a preservative in it, and that preservative is what makes it a hazardous waste. Anything with silver in it, a silver containing product. Silver nitrate sticks sometimes can be used extensively throughout a medical center. And we oftentimes, and it's just a lack of knowledge, it's certainly not the desire to not do it the right way, but we've oftentimes seen that these are just thrown in the trash. Some of the things might be easier for staff to recognize. Under the P listed waste, you will see things like the word arsenic. And arsenic, if you've ever, not that I'm saying I've ever watched anything like murder shows or how to get away with murder, I would never do that. But the word arsenic pops up a lot in that as a very common poison. And arsenic trioxide as a form of chemotherapy is another drug that has to be separated from the rest of your hazardous waste. Show
And
of thumbs, hearts, smiley faces. Do you use these products?
there's also the challenge of, when it comes to things that are regulated by um, oh, Jill, what am I thinking of? The EPA classification on personal care products. Where you throw away shampoo at home, but you can't necessarily throw away shampoo in the regular trash and send it to landfill at work. So there's just mixed messaging. Staff are trying to do their best. They want to do their best, um, but it is really complex. And so how do we help them navigate through these extensive waste regulations and figure out what the right thing to do is?
Yeah, what Allison is referring to, in some states, the decision has been made that certain personal care products, it could be shampoo, it could be toothpaste, it could be deodorant, that you provide to the patient in the healthcare setting, if it has an FDA label on it, might actually have to be disposed of as hazardous waste. Things you typically throw away at home, no problem, but because they are being provided within a healthcare environment, they are saying it falls within a different set of rules. Uh, we aren't seeing this widespread, but we do see it. And it is a very hard concept to get across when you say you can't throw that little tube of Crest in the trash. It has to go in this waste bin. So if you are in a state where you see that happening, it is something to get ahead of immediately. And if you wonder, Allison and I have, in fact, dumpster dived before. We have looked through trash and we have seen all of these types of things in them. Pathological waste. Do you have an OR? Do you have ambulatory surgery centers? Do you basically have pathology? We have found so many different paths that pathology waste can take that this is actually an area that requires some consideration. Basically, we think of pathology waste as recognizable body parts. So where do those show up in your facility? Again, the chat is open if anybody feels like chatting a comment in, but you will see them in the OR. And we know in ORs, people are in there doing surgery to save lives. So what type of containers do you provide for your OR staff to containerize any pathology waste. The container we're showing right here on the screen is a gray one. And it does say incineration only, pathology waste. The words that are on it um, are very prescriptive by regulation. We've also seen in certain instances where a hospital will have a red pathology bin sitting next to a red bio-waste bin. And that can provide an environment for, in the heat of the moment, disposing of things, a recognizable body part ending up in the wrong container. And again, depending on your state and your processes, a lot of times the red bag waste is autoclaved and then it goes to a landfill. So some of the things that we have seen are regulators following hospital trash from the loading dock to where it leaves the site to actually a waste disposal location. And they're going through that trash looking for different objects that should not be there. And some of those have included recognizable body parts.
There can also be, as staff are trying to make the right decisions, we have encountered over the years pretty consistently, we have encountered staff, not all staff, but staff that are under the assumption that if waste is placed in a bin in the hospital, it is being managed in a regulated way. Meaning they don't realize that if waste goes into a trash bin that's in a patient room or at a nursing station, that even though we as waste professionals know that that waste in that bin is going to end up in landfill and not be managed in a regulated way, that staff believe it is, and that they can dispose of things safely in a municipal waste trash bin just because they don't know. So we're, again, staff are trying to do their best, but we just have to make sure as the educators on this that we are not making assumptions about what staff do or do not know. We're there to educate and make sure we set the baseline expectation for this waste is going to this area, this waste is not going to this final disposition, is how I should say it.
Controlled substances are used throughout our industry. A couple of examples I put were oxycodone and Xanax, and they are defined by the Controlled Substances Act of 1970. And in a nutshell, any controlled substance has to be non-retrievable. So no one can be able to put their hand in wherever you're disposing of it and actually get out usable product. It either has to be neutralized or it has to be taken care of in a way, absorbed, that it can't be used. These are a few different types of products we've seen used in healthcare facilities. Some people love some of them, some people hate some of them. But what we still see in some places is that people are wasting their narcotics into a pharmacy container, just a regular pharmacy waste container, which is not an appropriate mode of disposal. Now, might you have something in your county, in your organization, wherever you are in the country that says you can still do that? I would love for you to send it to me because I'd love to read it. But we just want to make everybody aware that controlled substances is yet another waste stream that has to be managed within the healthcare setting. How many of you have some sort of controlled substance containers similar to what you see here on the screen, or a way that controlled substances can be disposed of? That's great. I love seeing thumbs here. Excellent. Look, more thumbs, more
Right.
happiness.
Yeah.
Okay.
All right. So what we really try to focus on when we're meeting with frontline staff, because they are exceptionally busy. We all know that. You're, especially if you are a nurse at the bedside and you're trying to manage multiple patients and multiple objectives that you're going about through your day, they really are trying to do the best that they can to follow standard correct practices. But it can be hard when you have to prioritize your time to get everything done in a limited amount of time and space. So one of the things we like to talk to frontline staff about or try to connect what they are doing to how that affects their communities. We all have, whether it's us or families or pets, we are all living in the communities that we work in or work nearby. And so we try to emphasize that improper waste disposal does have a direct impact on the communities that we live in. That could be anything from, the improper waste that ends up in landfill and it leaches things that shouldn't be leaching into the groundwater, and the soils end up there, and then from there it goes to many different areas. But we try to reinforce that our role is to be good stewards for our communities and our environment. We know that things ending up where they shouldn't be has created situations like the antimicrobial resistance situation that we're in now. We are trying to prevent issues like that and pollution, air pollution, water pollution, whatever it might be, from getting worse. So if we can try to connect the in the moment actions to, well, let's talk about how that waste, if that goes in the wrong bin, what happens? Does it inappropriately get incinerated and lead to air pollution issues for communities that are nearby the incineration facilities, or will it leach out from the landfill? That we found that to be a kind of an eye-opening message to help them understand that what they do definitely matters in the communities we live in.
And looking at this picture, and these are real pictures, these aren't pictures we, doctored up for the purpose of drama in the presentation. You see multiple waste streams mixed in here. And, one of the things that particularly draws my attention are sharps. I mean, it's estimated that 350,000 sharps injuries happen a year. And then the CDC says they believe that's underreporting by 50%. And that of those sharps injuries, 25% of those injuries happen downstream. So they are happening to EVS workers, laundry service workers, your waste vendors. And once they get out to that location, there's no way to know who the source patient is. So now you're having to determine whether or not those people have to go through some sort of preventive treatment to protect them. So we push to staff that the decisions we make in the moment could have a lifetime impact to somebody else.
And I know I used to be an EMT. I had several colleagues that went through the post-exposure prophylaxis, and if you're not aware of it, it has some severe consequences and impacts on your life, kind of in the short term and the longer term, several months to potentially the rest of your life. So, okay, now I live in Santa Cruz, California. So I would be remiss if we did not talk about this incident from the 80s. So we had the syringe tide incident where this was 87, 88, now that I'm remembering correctly. This was a true environmental disaster in New Jersey where raw sewage and hypodermic needles from a nearby landfill from the Fresh Kills landfill, ended up washing up on local beaches in New Jersey. And, I want to go to the beach and not worry about what is on the sand. And this is a really unfortunate, tragic incident that no one ever wants to see repeated. This led to some immediate or I would say long-term changes in the regulatory landscape for the U.S. Um, Jill, anything to add here?
They This is what actually ended up enacting the Medical Waste Tracking Act. And though we say, we don't like to inundate staff with, you can't do this because of this regulation or that regulation. If you can take a regulation and tie it back into a real world scenario, I would show these pictures. I would say these are the things that can happen if we don't properly dispose of our waste. So there is some give and take in using those regulations as a driver for compliance. Now, this is Love Canal, and some of you may remember this. It happened in 1978, and the effect of this event was that RCRA, Resource Conservation and Recovery Act, was enacted. What basically happened is that a chemical manufacturer decided they didn't want to manufacture the chemicals anymore, and they buried them in Love Canal. So they had all of this waste buried, and then the land was opened up and neighborhoods were built, schools were built, houses, a whole community was built on top of this. They had a particularly harsh winter in 1977, and all of that runoff went down into the canal. It seeped into the canal, and by doing so, it entered into the 16 acres of buried chemical waste. So that chemical waste rotted out of the containers it was in. It got into the groundwater, and it also started to just flood low-lying areas. So people were finding this material bubbling up in their basements. As a response to this, the population started to see an uprise in the number of miscarriages, the number of kidney diseases, liver diseases, and also just some mental issues with the children in the area. This was declared a national health care emergency when it became known that all of these houses had been built upon all of this waste. So when I talk to staff about, there is a regulation, it's called RCRA, but this is why the regulation is here. This is what happened to these people. This waste was improperly disposed of. And because of that improper disposal, they became sick with the miscarriages and the diseases and the long lasting effects to their children. So as much as we pull away from saying you have to do this because we said so and we are the regulators, because that gets you pretty much nowhere, we know that clinical staff's number one priority is patient care, and we fully support that in everything we do. We believe that when clinical staff understand that if we're not disposing of things appropriately, something like this can happen that will actually damage people in your communities and potentially make them your patients, it's a very compelling story.
All right, so here are some not so fun facts in addition to what we've covered. There is a study that was conducted by the U.S. Geological Survey in 1999 and 2000, where they measured samples from 139 streams in 30 states and found that over 80% of them had measurable amounts of one or more medication. So that right there tells us, or can tell a staff member, that there is a real world impact to improper disposal of certain types of drugs and medications. If it's allowed to seep into the environment, we then almost lose control of where it goes beyond that point. We never know if the water our dogs are drinking or the water our kids are playing in is contaminated with something that shouldn't be there. And then I think many of you have probably seen this statistic from Practice Green Health, where 15% of hospital waste is considered some type of hazardous waste, regulated waste. If you do the math on that, and Practice Green Health has said a hospital produces about 5 million tons of waste per year. So that averages out for a 475 bed hospital, it's 29 pounds of waste per bed per year. Um, which then 15% of that is about 750,000 pounds of hazardous material waste generated by one hospital per year, if that hospital is 475 beds. If you take even 10% of that and say, well, let's say there's a 10% diversion of that regulated waste away from appropriate waste streams into some kind of improper waste disposal, that's one hospital generating 75,000 pounds of hazardous, some type of hazardous waste that ends up in some type of disposal that it shouldn't be, some manner of disposal that it shouldn't be handled in final disposition. So these, then we multiply it by the number of hospitals in the US, and the impacts of this become so large so fast. So it's sometimes hard for staff to come out of that. It's kind of like the mentality of what I do will never make a difference. But truthfully, every single thing that ends up in a waste bin can have a dramatic impact on the communities that we live in. So, some people are very metrics driven. I mean, in hospitals, hardly anything can change clinically without the metrics to back it up. So, if you're looking for metrics, a lot of these numbers that are widely available can help you buoy your argument when you're talking with staff and leadership about a potential waste disposal problem. Oh, whoa.
Just some additional things to keep in mind that the UN Basel Convention considers healthcare waste as the second most dangerous waste after nuclear waste. So this is, as an industry, healthcare is being scrutinized for what is going on in terms of our waste disposal. And I had mentioned earlier that the CDC estimates that there are a large number of sharps related injuries that happen each year, considerable amount of those based on the fact that the sharps are not being appropriately disposed of.
Yeah. And one other thought here on this slide, actually, we're all familiar with um, how difficult it can be to maintain staff now. Staff turnover and retention is starting to improve following COVID, and that's fantastic news. But getting a sharps injury and even potentially having to be faced with the unknown of is my life about to change in the long term, that can have a dramatic impact on some people for whether they choose to stay in healthcare as a clinical provider or move to somewhere else and find a different career.
So here are a couple of pictures, non-identifiable pictures of some things that we have seen. And if you can all just take a minute and look at what you're seeing. And since none of us know who any of you are, show of thumbs, is this something you've seen in your facility? Nope. Yep. Nope.
I love the first thumbs down. That's awesome.
And then probably my question would be, have you gone and looked? Have you gone down to your loading docks and seeing how things such as e-waste, universal waste is being managed? Have you gone into your soiled utility rooms and looked inside your bins? We are in no way suggesting that you ever stick your hand inside of a waste bin. But you can go in and take a look, or go into your labs, see what are going into the containers in your labs. We have seen in most hospitals we have gone into, we have seen some instance of something similar to this. Not all, but most. So I would ask you to, with an open mind, take a look around and see what maybe you just haven't been focusing on. Allison?
Yeah, this is really I think one of the it's hard sometimes to dedicate time and effort into to going to all kind of all the areas of the medical center that you don't touch regularly. Everyone does your rounds, whether it's infection prevention rounds or environment of care rounds or alternate different types of rounds. But there can be those little areas that we don't often touch, whether that's an offsite facility or it's an ambulatory surgery center or it's a administrative facility that has an urgent care clinic. There are oftentimes bins or practices happening where some process has been implemented or a new something new has changed or a new person has come on board and they're really trying to do things the right way, but that way might not be consistent with how you would like to see it or how the medical center has decided to manage a certain waste. So it really is. I know everyone on this call is probably overburdened and you're having a hard time managing your workload already, but it really is important to go look in the bins that sometimes don't get looked in and see what's actually happening.
These are some additional pictures we've seen in different locations because your wastes aren't just generated on your floors. Your wastes are generated in your machine shops, your boiler rooms, off your roofs, um, mechanical, all kinds of locations. And these practices are not approved. One of the things we're looking at here, and you might say, well, what's wrong with the picture with the bleach in it? Well, are those compatible? We don't even know if all of those chemicals are compatible. And what happens if you have uncompatibles leak together in a small container? You could get a fire. We can see that there's waste oil in gallon jugs, which is something people do at home all the time, but it's something that can't be done in the healthcare environment. And we want to be very careful with cylinders. How are we disposing of waste cylinders? We don't want to accidentally shear off the top of a cylinder and have some sort of explosive device going through our walls in our hospitals.
Yeah. It's also important to make sure that you have your waste classifications completed and filed and readily available. And that leads into, part of what Jill was talking about is how do you know everything's compatible? Do you have all your waste classification for this waste being generated so that you can show, okay, this is a standard practice. We're collecting, grease or oil or lubricant or whatever it is, and we've done the analysis. We've proven that this is whatever you're trying to um, whatever discussion you're trying to facilitate with a regulator or a surveyor. Okay.
And we don't want to say, look at all of this work you have in front of you, all of the waste streams you have, all of the things you have to think about without giving you some best practices. So we have a few best practices that we would like to share. One thing that is critical is your vendor management. Who is your vendor? Who takes your hazardous waste? Do you autoclave your own red bag waste on site? Where does that go? Who takes your e-waste? Are you working collaboratively with them to make sure your waste is getting picked up in the amount of time that it should be? Do they label your accumulation start dates, or do you have your staff label your accumulation start dates? Make sure that your contract language and service agreements are very clear on what the expectations of your vendors are. We've seen some contracts where KPIs, key performance indicators, have been written into the contracts. And then those are reported back to leadership so that they can see that the waste is getting offsite in a timely manner. Can they help you? A lot of them have very robust management systems with your manifests, with waste characterizations in them. So make sure that you've got a good vendor, use the products that they provide to you as best you can. And I always recommend that at some point you go out and audit your vendor because we are responsible, cradle to grave. Go out there and see what they are doing at the area of final disposition.
Yeah. And with vendor management, it actually, vendors can also get overburdened and it takes them a while to catch up or additional staffing and additional pickups and their schedules. So if you have those KPIs built into your contract that you can circle back to and go, this is the agreement. These are the metrics that we agreed upon would measure success, and you either are or aren't meeting our measures for success that we mutually agreed upon, that can be a really powerful argument when you're trying to argue for additional services or additional staffing to meet the KPIs that you have agreed upon with them.
Another thing that we've recognized is that getting the materials in the right container really happens at the bedside. It is segregation at the source. We don't find that once you get to the loading dock, red bags accidentally get thrown in with trash bags and they end up at the dump. What we find is that it really matters that the staff who are providing the care and using the materials know the best ways to dispose of them. So, does your staff understand the different classifications of waste? How do you help them understand that? One way is you can have a color coding system for your containers. We're not suggesting this is the only way to do it. We're just saying that these are how we have seen it done in numerous locations. Does black always mean hazardous waste? Does red always mean biohaz? Does yellow mean chemo? Is blue pharmaceutical? Um, do you have waste posters that you put in your, typically we see them in soiled utility rooms. Are your rooms standardized? Do your patient rooms have the same types of containers in each room? So staff knows that if they have to get rid of some bloody material, that there's a step-on red container in the patient room. Is there a sharps disposal container in the room? Can you put a pharmaceutical disposer in the room? We don't typically see that there's hazardous waste containers in every room because we know the footprints of most patient rooms are quite small. But can you at least standardize what's going on in your facility and standardize what they are seeing in your soiled utility rooms? Put a picture. This goes here. Examples. You can do posters. You can do 1 point lessons, huddle messages. We've seen computer banners. Remember, sharps go in, pictures of what you have as your sharps container. Regularly educate your staff. It's hard to remember. I mean, you have people who do this as a full-time job, and every once in a while, we'll still go, where does that go? So make it as easy as possible for staff at the point of segregation, and you will have a much higher success rate than if you rely on a different group such as EVS to do the work.
Okay, so what we wanted to highlight on this slide is that if you are aware or become aware of a situation where there is some improper waste disposal, the solution will never be a single solution. Uh, Correcting or changing how a waste is managed, since you're managing it from literally the point of generation to even all the way through, changing a relationship with a vendor or getting new bins purchased or changing the bin setup that is standard for a room, it will always require both a top-down and a bottom-up approach to managing the issue. You can see from the accreditation standards that we've listed here, and again, these are just a small example, but you do have regulatory drivers for not just regulatory drivers, but accreditation standard drivers for going to your leadership, your executives, and even potentially your board of directors if you have um, a, a an effort that is going to require significant time and resources to change, that you do have these drivers from the accreditation standards to show that leadership does have a responsibility to help the organization meet regulatory requirements. I think every executive and every board of director member knows this, but this can be a really valuable tool to remind them of this, because this will never be fixed just by going to the frontline staff at the point of generation and saying, hey, you've got to do better. If they're not doing better, it's because some part of the system they're working within is not working for them. So our job as safety professionals is to go in there and figure out why the system that exists is not working for them. And then how do we adjust the system to make it easier, more convenient, more straightforward, whatever it might be, so that the organization is not placed in a position of liability for this improper waste disposal.
And finally, and I know we're running out of time, so I'm going to run through this quickly. We feel very strongly that the litigious nature of this is going to continue to move across the country. So look at your trash before your regulators do. Set up some trash audits. Set your goals and objectives, get your team, select a time frame, grab some bags of trash and go through it. It's not glamorous. I didn't always love to say, what do you do today? Well, today I went dumpster diving through some trash, but I found some really cool stuff. So we suggest that you start looking at what you have. And then if a regulator does come out, you can already say, look, we've started looking at this problem and we are trying to get ahead of it and get our hands around it if it does indeed exist in your facility.
All right.
So we know we've left a whopping 3 minutes and 5 seconds for questions. But if any of you do have any questions, we would love to answer what we can.
And Elizabeth, I know there's two questions in chat, but for whatever reason, I can't seem to see them.
Sure, I will read them. The first question is, epinephrine, are all concentrations hazardous? Does all epi need to go in a black bin? I hope I asked
Wow.
that
Yeah.
question.
So not knowing exactly what you have, we would always say err on the side of caution. And typically, yes, epinephrine has to go into a black bin. If you think for some reason you have something that is um, that is not concentrated, you can always have a waste characterization done on it, and then you have the documentation that this particular application does not need to go in there. But typically speaking, yes, epinephrine goes into a black bin.
Yeah, and if you want to put a bit more information, either privately or something, we could certainly circle back with you afterward. But I agree with Jill. Without knowing more specifics, it would be it's difficult to provide any other answer.
The other question I have here is, are there any other options for rendering a controlled substance irretrievable other than Cactus and RX Destroyer?
There
Mm.
are. We saw another option that I can't remember who the vendor is, but it was not RX Destroyer or Cactus Zinc. It's in the pictures that we sent. I believe it might have been a Stericycle option that we've seen used before. And I would ask your vendor, whoever your vendor is, what options do you have available for us to meet this requirement?
Yeah, and we don't endorse any products, but we just
Right.
wanted to highlight the range of different options that are available, although we certainly did not include every single option out there. It would, answering that question would for sure depend on the situation. Is it in a patient room? Is it in the pharmacy? Where exactly is that happening? Because that might also drive the most appropriate container option for you to select.
Okay. Thank you. I think those are all the questions we have time for. So with that, I'd like to thank everyone for attending today's webinar. Please look out for our follow-up email within the next few days, which will include a link to access today's webinar recording. If you have any additional questions, please don't hesitate to contact us. Thanks again for attending, and we hope you have a wonderful day.
Thank you all
Thank you,
very much.
everyone.